Welcome everyone to this morning's Global Café. So as Alana said, my name is Katrina Buzanis. I'm a Director of Policy and Advocacy at the IFA. I'm very happy to welcome you today. So in our rapidly evolving world, technological advancements have become a part of our daily lives, influencing almost every aspect of society. But one area that deserves special attention is how technology is transforming the aging experience, but also improving the lives of older people. So with growing aging populations around the world globally, technology can be harnessed to serve aging populations, but older people can no longer be left out of this innovation. So today we'll explore how these kind of different technologies can change the way we age, can enhance quality of life, and create new opportunities for physical health, mental health, and social connection. And so with us today to talk about AgeTech and the future of aging and technology is Dr. Andrew Sixsmith. So Dr. Sixsmith is the Director of the Science and Technology for Aging Research Institute and a professor in the Simon Fraser Gerontology Department. Dr. Sixsmith was a co-founding scientific director of AgeWell and is currently an associate scientific director. And so his work has involved him in major international research projects and initiatives with academia, government, and industry. So welcome, Dr. Sixsmith. Very happy to have you with us today.
Thank you very much. Thank you for inviting me here today, and apologies to anybody who tuned in last time. I was unfortunately indisposed at the very last minute, but I'm really looking forward to today's session.
Yeah, we're glad that you were able to make it with us this morning. And so, I mean, the nice thing was that we had kind of quite a nice dialogue. And so I think there's going to be a lot of comments and questions on the line for you today. So I want to kick things off and maybe kind of take things back to the beginning of your career and ask, how did you first become interested in studying aging and improving the quality of life of older people, but also what prompted you to start thinking about technology as a way to improve the lives of older people?
Okay, right. So we're going back to the dawn of time here in my career. Originally, I wasn't specifically interested in aging as such. I'm a human geographer by background, and I was involved very much in mathematical modeling back in the day. So I come from a very quantitative background, and I was interested in a technique within human geography called location allocation modeling, which is basically looking at the distribution of things like population distribution, and then how is the best way of organizing things according to the population distribution. And I was looking for a kind of a case study to do my work. And it just so happens that there was an initiative in the sort of the region where I come from, back in the UK, in the northwest of England, that were developing a whole network of new kind of specific facilities for people with dementia. So this was just happened to coincide with what I was doing at the time. So I basically started on that work, and that was my first ever kind of basic research when I was doing a master's program. But while my initial interest was in the mathematical modeling, I began to get interested in the whole issue around population aging, its impact on health services and the need for health services, and the way we should be delivering health services to support an aging population. Now, this was many years ago. We're talking about 4 decades, and unfortunately, I really think that many of the issues that we were aware of 4 decades ago are still with us, and just begs the question. We've known of the changes that were going to happen. Maybe 4 decades ago we didn't realize the kind of the very significant impact of population aging in the mid 21st century, but we had pretty good idea. And so really and truly, we should have been better prepared. And, you know, we hear so much about healthcare systems in crisis, and the demands being made by population aging, and we hear words like the burden of older people. So that, in a kind of a way, that's a bit disappointing. That I think we should have responded or provided a much better kind of system of supports than we do right now. So that's my thought there. On the issue of quality of life, I actually started to move away from the very quantitative aspects of research. I'm more interested in the experiential things, and particularly around dementia. So my grandfather, who I was very close to, had dementia at the end of his life, and was admitted into a horrible dementia-specific facility back in the day. We don't have them anymore, thank goodness. But the sort of place that he was admitted into. But you know, I could try to look at it from his perspective, and I was thinking, well, you know, this is not something a place where I want to end my years on this planet. So I got more and more interested in the what you might call the experiential side of things, and I started doing more qualitative research. And for my PhD work, I was very much interested in how people experience aging, and particularly looking at things around the experience of communities, neighborhoods, and people's own homes, and how the physical environment, being a human geographer, how the physical environment kind of supports or limits our independence and quality of life as we grow older. So that quality of life issue became really important to me.
Mm-hmm. Yeah.
And what prompted me to think about technology? Okay, well, this is an interesting one. So everybody's got people in their careers who make an impact on them. And one of those was when I originally, my original academic post was, believe it or not, in a department of psychiatry, even though I'm not a psychiatrist by background. But my research that I've been doing in dementia and health service provision, that kind of thing, was very pertinent to the sort of work that was being done at the University of Liverpool at the time, which was doing a lot of work on aging, dementia, and the prevalence of dementia, and how we should best respond to the increasing numbers of people with dementia within the population. So my professor at the time, John Copeland, who was a really great guy, he said to me, well, why don't I just spend a bit of time thinking, well, where should the field of gerontology be moving into in the future? So basically, I came up with 3 topics that have really kind of provided me with a basis of my entire academic career. So the first one of these was, how can we support quality of life? Indeed, what do we mean by quality of life when we're growing older? And particularly to challenge the sorts of the prevalent biomedical view of old age and the kind of ageist attitudes that are prevalent in society about what it is to be aging, and to focus on, well, what do we mean by quality of life? How can we support quality of life? And it's not just about being free from disease. It's not just about activities of daily living. It's about what are the meaningful things in everyday life as we grow old. So that was one area that I was particularly interested. I've become increasingly interested in. A second area was indeed this topic of technology. And while technology in aging still isn't a major kind of direction for research, we live in an increasingly technological world. And even back when I was starting out my career 4 decades ago, we were aware that technology was having an impact. Strangely enough, I was involved in a research project with in-car technology. So right back in the day, they were doing things such as, well, driver monitoring, so it could provide alerts, parking assist, that sort of thing. So the automobile industry were getting very interested in how technology can help people whose abilities might be declining. So I was involved in a project, only in a little way, but I was involved in that. And that kind of made me think, well, how might technology be used in all sorts of ways? Now, one of the other things about my background is that my first ever career prior to going into academia was as a computer programmer. So I was really well versed in developing it's a bit archaic nowadays, but I was really well versed in computer systems, developing, writing programs to do X, Y, and Z. So it was something that I was very familiar with. So the penny just dropped that, given that we're living in increasingly technology-mediated world, then what does that mean for people as they grow old? So broadly, what is it like to age in a technological society? And then secondly, how can we use and mobilize technology to support the health, the independence, quality of life, and social participation of older people? So that was topic number 2. And the topic number 3, and probably we'll come onto this as we go through the discussion today, was around population aging in the developing world, or lower and middle income countries, or what we want to call them nowadays. And again, as somebody with a lot of demography in my background, I was very aware that population aging, even though it's particularly being seen as a what you might call a first world problem, looking at Europe, North America, Japan, for example. While we were, again, 30 or so years ago, we were aware of that population aging in our own countries. So I was in the UK at the time, looking at the global demographic changes. The the big deal wasn't going to be so much in countries like the United Kingdom, or indeed in Canada, where I live now, but really globally in countries in the global South. So we're seeing massive demographic changes in countries in Africa, in South America, and Asia. And I think, if we do have a global perspective, and I'm speaking today to the International Federation on Aging, that international perspective has to be at the forefront of our thinking. At the time, again, I had another colleague who was very influential at the time, someone called Ken Tout, and he'd actually written a book about aging I think it was called Aging in Developing Countries. And I thought, well, that guy has really been looking at things in a different way to what the vast majority of gerontologists were thinking at the time. So those were the key themes of what I was thinking 30 or so years ago. And pretty much they've stayed with me all my career. Yeah.
Yeah, thank you. I mean, there's a lot to pick up on there, which I think, we'll kind of pick away at some of those threads throughout our conversation. But I think that was a great way to set the scene and open up the conversation. I guess maybe I'll start with, when we're talking about age tech specifically, what sorts of things are we talking about? What are some kind of examples, and also how has that evolved from back, some of the technological, innovations that we were seeing when you kind of first started. And I'm wondering if you can share a little bit more about what are some of those specific things that we're talking about when we're talking about improving the lives of older people using technology.
I think we need to compartmentalize it a little bit. So firstly, there are those, as I said before, we're living in an increasingly technologically mediated world. So we need to understand what the experience of aging is in a world that is dominated by technology nowadays. And we've seen, in the pandemic, just how significant technology is in our life, how it connects us to other people, how it connects us to services, et cetera, et cetera. So part of the work that I do is to try and understand that process in a very broad sense. So in many ways, it's not people working at universities that and doing research on technology and aging that is making a big difference there. It's companies like Google, Amazon, or in Canada, TELUS, Rogers, et cetera, who are introducing technology more and more into our lives. And this is a global trend. So question one might be, what is aging in a technologically mediated world, and increasingly technologically mediated? Does technology or does changes within technology help us, or does it hinder us in certain ways? And what are the particular implications for older people? As the world changes, we have to adapt, and that can be challenging for people in many ways. So, for example, learning new skills can be a challenge. However, we should be also aware that the old saying that you can't teach an old dog a new trick, doesn't really hold. What we saw with the pandemic is that we age well. The network that I was involved in did research around this. Is that given the kind of the value proposition of a technology, people will adopt it, right? Whatever their age. Although I do recognize that older people do tend to be less users of kind of everyday technologies, and that does increase with age. But we shouldn't have ageist attitudes around the use of technology. So the first issue is what is aging about in a technological society. The second question is that we're seeing more and more of the vital services that are important in our life, such as health services, increasingly moving to a technology-based model. So again, I was reading about what you might call the telehealth or or telecare industry at the moment. So increasingly, health service providers, both within the public and private sectors, are trying to move to a more technology-based system. That has proved extremely difficult for health services over recent decades, while many other sectors of our economy have changed quite significantly and adopted new business models. Health services have been really challenged in terms of adopting technology into the way they deliver services. But again, we saw things kick-started during the pandemic in terms of using technology to access services that are important to us. The issue here is whether it is that we shouldn't be seeing technology, or this is my belief, that we quite often, people in government that I speak to, they see technology as a kind of a bandage to the services that they provide, or a way to reduce costs, right? I actually see technology, or we should be seeing technology as a way of helping people to access services and providing more options. Sorry. I have an ambulance going past me in the back, so I can't hear myself talk at the moment. I'm sorry about that.
No.
Yeah, it's gone.
Okay.
Yeah, so that was not in response to what I'm saying, but yeah, I've lost the thread of what I was saying now. Is that we shouldn't be seeing health technology as just doing what we've done before. We shouldn't see it like that. We should see it as a transformative process, and hopefully that transformation will be in a positive way. So I see technology as a way of extending the options, making it easier to access services or whatever, right? Mm-hmm. However, there are very significant challenges around this. So we're seeing more and more things move online without, really considering what the challenges are for the person who are going to use services, right? And I think particularly the government sectors have been pretty poor at understanding who their customer is. I can speak from a Canadian perspective, right? So, for example, there are things online provided by the Canadian government. Some of the worst websites I've ever seen in my entire life are supported by the Canadian government, right? It's shocking, some of the terrible ways. If you're trying to access information, you're trying to, crucial information. And I'll give you a good example of the, and it was it happened during the pandemic, and you know, there was no other way around it. But many older people in Canada, for example, are dependent on income support on top of their pensions, and they will only get that if they file their taxes in time. Now, when the pandemic hit in March 2020, it was catastrophic for many people because they were now having to file their taxes online, and it was very, very difficult for them. I work with community organizations who were trying to pick up the pieces around that. So we need to be aware of how things which we assume are going to work actually work in practice. Another example of this was at the back end of the pandemic, when we were all using the vaccination cards, et cetera. Those were introduced across Canada, again, using Canada as an example, and in the different provinces in Canada, with virtually no consultation whatsoever. And people were expected to be able to navigate the systems, online systems, to be able to access a vaccination card, access vaccination, et cetera. So those were really quite challenging for many people. And I think it kind of reflects, well, you know, health services tend to do it from their perspective, and regardless of the abilities of people to actually access and use their technologies. And it's, you know, I'm talking about health services, but increasingly we're seeing it in all aspects of society. So, for example, another gripe of mine is that if you want to get a ticket to go to an event, such as a concert or a football match, you can't do that in many cases without a smartphone, right? Not everybody has a smartphone. Not everybody wants to use one. And I remember going to a Vancouver Whitecaps soccer game a couple of years ago, where I had to simultaneously show a vaccination card, my personal ID, a ticket, and hold an umbrella, because, you know, it's always raining in Vancouver at the same time. So in order to do this, you needed at least 2 smartphones and 3 arms, so it could hold an umbrella at the same time. You know, you get where I'm coming from here. Not very user friendly, put it that way. So that's question number 3. How is the vital services that are crucial to our everyday life, how are they being developed and implemented? And are these being done in an exclusionary way for many people? Because technological change will leave some people behind. Okay, so we need to be aware of that and try and implement technologies, particularly in fields such as healthcare or income tax or whatever, in a way that is actually going to include people. So that kind of idea of age friendliness or inclusiveness has to be thought about.
And I was going to
go on.
Maybe pick up as well on one of the questions in the chat along those same lines, which is Shmuel, who asks about opportunities for development of age tech technologies in poor and low and socioeconomic countries. And, you know, you mentioned LMICs. So I'm wondering if you can pick up on, you know, it's kind of a similar thing to what you're saying, which is that not everybody will have that access. But as you mentioned in LMICs, you know, that some of, you know, we're seeing population aging there as well. So I'm wondering if you can, you know, pick up on. Well.
Yeah. So again, I think it's I'm not an expert in the, you know, aging in the global south in LMICs. I'm trying to develop my knowledge and experience as much as possible. And I do have, knowledge from a demographic perspective. But I'm increasingly aware that, technology is, or technological change is happening globally. So we've got to be aware of that. I have been speaking to colleagues and trying to understand how it is, what it is like to age in different countries, and what are the challenges that they're experiencing, and what are the and what is the role of technology. One very interesting example that I was conversation I had was with a colleague in Nepal. Okay, and he was really telling me about how aging, social change, urbanization, and technology were actually intersecting, and was able to give a really poignant example of how those all these factors are intersecting. And he was talking about a family in Nepal where the mother and the father were living in rural part of Nepal that was suffering the ravages of climate change in a particular location, found themselves having to live in, or were living in a rural area, spending a lot of their time trying to find firewood for fuel, trying to find water or bring water. So increasingly having basic challenges like that. The son of the family from Nepal was living long-term in the Middle East, where he was engaged in building initiatives, such as the building the World Cup venues or whatever they were for last year, and basically was funding the families back home in Nepal. And then the wife and the daughters were living in an urban area of Nepal. So we had extended family, but geographically dispersed. The only means of contact was through the smartphone, really. That's the way that family was maintaining its connection. It was crucial for the economics of that family, for the husband to be in, in the Middle East, to be able to connect with them, to be able to send money back, wire money back, etc., etc. So it just shows you, I thought that was a very poignant example of how technology, right? We're living in a world where technology has actually enabled that kind of thing, and we're using technology to try and adapt to the way that the world has been evolving. Mm-hmm. So one other thing about about lower and middle income countries as well is I was speaking to people. I've got colleagues at the business school, Imperial College in London, who've been involved in projects which they refer to as frugal innovation. And this is a really great concept, because quite often in my field of social sciences and gerontology, it's people such as myself and universities such as those that I work in, Simon Fraser University or Imperial College in London or whatever, where the knowledge lies and that the knowledge flows into and innovation flows from from countries like Canada or the UK. But the idea of frugal innovation really is about, well, if technology is developing globally, right, it's got to develop within the context or the reality within which people are operating. And in many ways, technology is being developed and adopted in ways that are very innovative, and where countries such as Canada could learn a lot from. So it's a much more kind of mutual concept of knowledge sharing. Some very interesting, not particularly high tech, but for example, there was a very interesting paper I read about prosthetic limbs and being developed in lower and middle income countries that worked, were relatively inexpensive, et cetera. And that actual model was being used in countries like the UK in a much more cost-effective way than traditionally being done. So we need to be thinking in those terms as well.
Yeah, I think that's, I mean, it's interesting, I think, how much you can actually get done when I guess there's kind of using a little bit more of that innovation, as opposed to, you know, in places like Canada where you would think you would have access to all of these technologies, but it's still kind of lags in so many ways. But I want to go to a couple more questions and comments from the chat, just that you can hear some other voices as well. So Anna Maria, I believe you had a question. Do you want to unmute and pose your question to Dr. Sixsmith?
Which one? I put a couple. Well, my main concern, thank you very much. My main concern is how we can have technologies accessible to older adults. COVID taught us great lessons, especially the increase of social isolation. But at the same time, a couple organizations rose to address the social isolation. But also we became very apparent the digital divide. We have focused mainly, or you have focused on the low-income countries or on the third world countries. The reality is that even in Canada, we have that digital divide. So what kind of policies do you think that can address? Because I think personally, I think that there is a need for private and public convergence, so to speak, to address the digital divide around the world. So I would like your opinion on that. Thank you. Because technology is becoming apparent that is very helpful to keep older people healthy and aging well and improving their quality of life. Thank you.
Yeah. So I totally agree with you that the digital divide is a key issue that needs to be addressed by politicians. I actually did work with community organizations back in Vancouver a few years ago that were particularly focusing on this as a kind of a community-based research project. So the research that we did was to look at, well, how are people experiencing this digital divide? What impact is it having on their lives, and what are the sort of policy recommendations that we need to implement? So I totally agree with you that it is a very significant issue. I would argue that we should see digital inclusion, or being able to access the digital world that most of us are living in, as almost as a human right, because if you don't have access to the digital world, you are excluded from a huge part of modern society and the modern economy, right? You're going to be extremely disadvantaged. Now, some people might want that, right? So, frankly, even though my particular area of research is technology and aging, I'm very skeptical about technology. So I do not engage in social media, all that sort of thing. There's a whole bunch of things that I really don't like about how technology is imposing itself on our lives. So I think part of what we should be doing is to really push against some of the more negative things that are happening with technology, and it's beholden on us to resist those things. And we could perhaps talk about some of those. But the digital divide, there's two ways of looking at it. There's a kind of a usability divide, and there's an economic or financial divide. To some extent, they are separate. And going back to the comment that I was made before, there's a lot of ageism around in society. I think we're all aware of that, about what older people are able to do, you know, what their motivations are, etc., etc. You know, as I mentioned before, the pandemic showed that people are able to engage with technology if there's a strong value proposition for them. So, but we should be aware that for many people, using technology is going to be a challenge. Now, part of that is age related, part of it is economically related. So, you know, if you've not been, you know, if you've not had experience of using technology, picking it up is going to be difficult. Okay. The second part of it is financial. For many people, even a low cost internet or data plan is going to be very, very difficult for them. So I really think governments should be thinking creatively about how they're going to include people into the digital world, and that this shouldn't just be left up to the communications companies. Now, I did work with a local community organization, and they actually used our research to lobby TELUS in Canada to introduce low-cost internet and mobile data plans for those people on income assistance. So low-income older adults. So a basic plan was introduced for them. But I think more widely, we still need to be thinking about improving access and affordability of internet access, the devices, etc., etc. Yeah. The second thing is that, going back to the issue of usability, is that not everybody is going to find technology easy to use. So we have to have the options for those people that, or the supports for people who aren't able to use technology or get help and support to use it. And again, I've been working with community organizations to provide you know, on the ground support to those people who may be disadvantaged. So I'm about to start a project with one of the Vancouver community organizations called Better Connected, which is, well, how can community organizations, which play an enormous part in the in a country like Canada, supporting economically disadvantaged older people. For those people who are not from Canada on the call today, Canada, particularly the city I live in, there's a very, very strong network of community organizations focused on the needs of older people. and that is a very important resource. And if we can mobilize those resources, community resources, I think that would be a really major, a major direction that we should be going in.
Mm-hmm. Yeah, thanks, Andrew. I want to make sure that we get to a couple of more questions in the chat. So I want to invite Kelly to pose your comments and question.
Thank you. Good morning. I'm having a bit of fangirl. I've been citing you in some of my work, so it's really a pleasure to meet you. I really enjoy this conversation. I've been spending the summer doing quite a bit of a deep dive into this work, really particularly interested in the acceptable use of AI in the care of older adults, but also sort of updating my state of knowledge and the use of technology in the care of older adults. And one of the distinctions that I put in the chat, I put a couple of recent scoping reviews that we found. I'm not the author of them, so it's not self-promotion. So just in case others find it useful, I've popped them in the chat for you. But one of the things we found around technology is this distinction between the intentional design of technology for older adults and the application or the incidental application of technology onto older adults. And I think that's quite different and a little bit aligned with what you were saying. But I just wanted to check in with you if you've come across in your work anything in the area of the acceptable use of artificial intelligence in the care of older adults. We're seeing a couple of things. We're seeing in the reading that we've been doing that AI is being used to support detection. So for example, mining EHRs for signals of delirium or mild cognitive impairment or gait abnormalities, or prediction or classification. But just wondered if you have anything that you could share in that area.
Yeah. So I'm really glad you brought that up. And it kind of, I didn't really get onto the third area of research right at the start of the presentation, which was around those technologies which have been specifically developed to support the needs of older people, whether those people, were challenged by dementia or some sort of chronic illness, etc., etc. So my network, or the network that I helped to found, AgeWell, has over the last 7 years put a lot of effort into developing technologies to support specifically to support the health and well-being and independence of older people. So we're talking about those sorts of technologies which are being developed and implemented with particular issues in mind. So for example, as you said, technologies that might be detecting changes in a person's cognitive state, or particular conditions. I actually did work before I came over to Canada a few years ago on using technology to support people with COPD, chronic obstructive pulmonary disease, which is a very challenging condition to live with. So we need to be and I'm very glad you brought up the topic of, well, okay, these technologies are being ostensibly developed to help people, but what are the kind of side effects of them, right? When we do clinical trials, we talk about, does it have a positive impact on the issue that we're trying to address? But does it also have side effects? And there are side effects with the introduction of technology. And those can be quite significant. So I'm glad you brought up that. And I think particularly in the field of AI, and going back to my original career, I was involved in AI back in the day. I was doing lots of work around around it, and I'm looking at it now, and the world seems to divide quite, or polarize around AI. Well, some people think it's going to solve all our problems. Other people think it's a quick way to going to downhill fast in society. So it's difficult to say which way it's going to go. But AI is embedded into a lot of technologies. So I'll give you a good example of one project that AgeWell was involved in, which I think is potentially could have a lot of benefits, and that was to use facial recognition technology, right? Which I'm sure is the most big brotherish of all technologies, to look at or to detect pain amongst residents in nursing homes, long-term care facilities, who are experiencing pain, okay, and who cannot communicate, right? So if again looking at it experientially, being in pain and not being able to communicate that is, must be a very, very horrible thing, right? And in the context of long-term residential care, where the staff are basically running around trying to do all sorts of things at the same time, many people might be sitting there having some kind of pain or painful episode, and it's not being observed. So could we use facial recognition to detect pain in the facial expressions of people? So potentially, I think that sort of thing might be very useful. So it could provide an alert to a caregiver saying, so and so, that Mrs. X or Mr. Y is in pain at this moment, right, or has some sort of need. So possibly we could use it for that. However, we need to be aware about how these kinds of technologies might be implemented, and going back to the kind of side effects of AI-based technologies, or surveillance technologies that we might want to call them, is a very, very serious issue. And if we're going to use technology to monitor and observe people, we need to be aware that that is going to impact on their lives in ways that we'd not anticipated. Inevitably, that happens. There's some really good, people have looked at some of the pioneering theoretical work around this sort of thing amongst authors such as Michel Foucault in France years ago, talking about how surveillance impacts on the way that we live our lives. We can see that it has very tangible effects when we introduce monitoring technologies or surveillance technologies. And I've observed this in practice. I'll give you a good example of this, is that I was involved in a project that used in-home activity or movement sensors to detect people's movements when they were in the home. It could detect when a person is out of the home, when they come back in, when they have visitors, what their patterns of activity were during the day, whether they were moving, et cetera, et cetera. So using just very simple movement sensors could detect quite a lot of stuff. The AI component of that the idea was to develop a kind of a typical pattern of activity. And if a person's for that person, right? So over a training period for the AI system, it could come up with a kind of a model for what a typical day would be for the person living in this home. And then if the person deviated from that, it would raise some kind of alert to a caregiver. This actually, when we use this system, did have some very significant positive impacts on people. Firstly, we detected, it was a very small trial, but we detected a very significant change in the pattern of activity of one man. And when we followed it up, we discovered that his sister, who was a major caregiver for this fellow, was not visiting him on the regular basis that she previously was, because she was now looking after her own husband, couldn't come and look after her brother as much as she'd previously done. And he'd become immobile. He had dementia. He wasn't able to go out and buy food, etc., etc. If that had gone on for more than a few more days, I'm convinced that he would have ended up in the emergency room, long-term residential care, etc., etc. So you can see that the technology may have particular benefits, but the same technology also detected somebody who was going out of his house during the night, right? Unbeknown to anybody else, the caring services or the family, etc., etc. And once that knowledge was, people became aware of that, he was stopped from doing it. Now, I'm not saying it was safe or unsafe for him to go out at night, but the impact was that the monitoring technology had detected something that the caregivers, the healthcare system, and the family were not happy with happening, and that changed this man's life in some way. And I'm not saying it was a good or a bad thing. I'm just saying it had a significant impact on the way that man was living his life. And yeah, we should be aware that those things are going to happen. And indeed, on another example was a woman.
Sorry, I did not cut you off, but we are just very rapidly approaching the end of the hour.
Oh yeah. Sorry, yeah.
I know the time really flies on these sessions. So I do want to just take a minute to introduce our speaker for next week's Global Cafe, and then I'll maybe just give you the last minute to have the last word for any key takeaway messages that you have. So our next Friday's session is going to be on the preventions of violence and abuse against older adults with Ms. Marta Hajic, who is the CEO of Elder Abuse Prevention Ontario. So I hope you'll all join us next week for that. And Dr. Sixsmith, I'll give you the final minute, maybe just to give some key takeaway messages from the conversation. I'm conscious that we've only scratched the surface of this topic.
Takeaway message. Okay. Technology should be something that supports us and improves our lives. It shouldn't be something that is going to oppress us in any way. And we've got to be aware of whether it's everyday technologies like smartphones, healthcare services, or indeed the specific technologies that we're developing with older people in mind, that these are done in ways that what you might call as ethically appropriate, inclusive of the needs of all of society.
Thank you so much, Dr. Sixsmith. That's a great note to end on. And like I said, we've only scratched the surface. There was kind of a number of topics that I wish we could have had a little bit more time to delve into, but we'll have to continue the conversation on another Global Cafe. So thank you so much to everyone for joining us on this Friday, and hope to see you next time.